begin in Nakuru, where the health workers' strike is in its third day today. The health workers have vowed to stay put until they're given their delayed promotion, salary arrears and missing allowances. Our Nakuru reporter Kamche Menza has been on that tour of the county and now joins us on phone with the latest. Menza, how many hospitals have you been to so far, and did you meet some of the patients, and what are they saying about this particular situation?
Thank you, Ian. Right now I'm at the third hospital that is in Rongai constituency, and it's the Rongai sub-county hospital. What we have seen here, the situation is not different from the two other hospitals. That is Nakuru, Rift Valley Provincial General Hospital and Bahati sub-county hospital. Operations have been paralyzed. There are no health workers there, and patients actually are stranded. It's like most of them actually didn't know about the strike. They have traveled a distance, having in mind that a hospital like Rift Valley Provincial General Hospital is a referral hospital to many. So they've traveled from so far, and there are no services. Found most of them there, they're stranded. And right here now, there are sinful women who have come with their babies for vaccination, but there is no one to attend them. So they're just seated under a tree, actually, having no hope of getting any services up until now.
Menza, there are reports that perhaps a number of deaths have been reported as a result of these strikes. Is this true?
True. Ian, yesterday we had a meeting with the county deputy governor. He talked about 2 reported deaths, but he said they were not as a result of the strike, but just normal deaths. The 3 other deaths, which add up 5, I called the South Rift KMPDU Secretary General, and he told me he's calling to confirm that, and he'll get back to me in a while. But at the moment, that is the situation. It's like the reports are still not confirmed as yet, Ian.
With such situations, what are we saying? Is there a meeting between the health workers and the county government or the Ministry of Labour, perhaps?
Yes, there was a scheduled meeting that was meant to happen this morning, but it didn't happen on reasons that the county, the unions were, according to what we are being told, is that the union, doctors' union, were supposed to submit also, to give in their submissions also, but they did not. So in the morning, what happened is that the county government gave out their submissions to the Labour office, while the union did not. When I called the union representatives, they said they were not told of any meeting, and that they have just received a letter at around 11 a.m. this morning. And now is when they are preparing themselves on how they will go for that meeting. But initially, they were not aware of the meeting. So nothing has taken place in the meeting so far, in any meeting so far.
Well, Menza, also the health workers in Nakuru County particularly have raised a lot of concern over how the devolution of health services has been handled in that particular county. Are you able to perhaps give us just a brief background on this particular issue and some of what the issues they're raising?
Ian, true, there have been so many grievances from health workers in this county, and considering that this is the 7th strike they are holding since people, their grievances, it's more or less, their grievances are more or less the same ever since, because even the county government says it has been trying to address them gradually, but not fully. Any of the grievances, starting with the promotions, the delayed promotions, payment of allowances and missing allowances, and their arrears, they have not been fully put into consideration. And those are some of the things that they have been crying for ever since up until now. So now they say enough is enough, because even the meetings they hold, they don't bear any fruit. Yeah. And
finally, Menza, just before I let you go, are we seeing the county government doing anything about this particular issue? Because patients are suffering.
I don't know how far the county government will go, because now it's like they have resolved to take the matter to the Labour office. It's like they have failed, or they have been challenged enough to sit down and agree on how they are going to operate without any strike. The issue that they're taking the matter to the Labour office is a good indication that they can no longer, handle the issues or the cases that the health workers are giving to them. So we are waiting to see what will come out of the meeting that is being held with the Labour office. Probably that one, they might find a solution.
Thank you very much there, reporter Kamche Menza, coming to us via phone from Nakuru, where, of course, the health sector is experiencing a lot of challenges with the health workers on their third day of the strike. We shall keep you updated on this particular issue.